I'm Dr. Ravi Tanagan.
I didn't see him checking pulse and BP.
Road roller allada kayude. Log roll.
That full series which I've done, oh my god. Hey friends, Dr. Bob here, ENT surgeon based in India, and today let's react to all the medical scenes acted by Prithviraj. So the calm and confident medical student and his journey to becoming a doctor. And let's see how accurate these medical scenes are. So let's react to it and dissect it medically and cinematically.
Sir, I'm Dr. Ravi Tanagan.
Doctor,
I'm...
Doctor, this patient unconscious आयी.
Tanagan, you seem fast.
Huh?
Go, quick.
Sir.
I think so, that's it. He just met the senior consultant there and he's directly appointed. More likely looks like the situation here is of a primary health center where there'll be limited treating doctors, and there'll be inflow of many people from the village areas. So a situation like that where there's less a doctor, you get good hands-on, good experience, and it can also be overburdening also because lesser manpower, right? So the main difference is that in this primary health setup is that you get the basic treatment, basic care, and when it goes to secondary setup, there'll be specialists available, and tertiary setup, there'll be specialists and super specialists that are there. So it's nice to see that without any waiting period, directly he just walks in and he gets his appointment and he's working there now.
Thanks.
Tanagan,
Sir,
is he okay?
pulse and BP normal aanu.
Sister,
Wait, pulse and BP normal? For that, he didn't. I didn't see him checking pulse and BP. And how did he say it's normal? Basically, it's your pulse which you felt in the radial artery. So, which we use the timer and we see and assess for a period of 60 seconds and we calculate. Or there are some people even do for 10 seconds and they multiply. Otherwise, the BP is something which we check again in the brachial artery. So we use the BP apparatus, we keep it, and we also use stethoscope. So we can either use palpatory method or we can use with the auscultation with the help of a stethoscope. And he got a call saying the patient is unconscious. So when he got the call of unconsciousness, patient is unconscious, he rushes and he has to obviously check the vitals. Along with that, one important thing we always check is saturation to see the oxygen the patient is having. And based on that, you have to take a call. And if it is somewhere where the patient is not breathing, there's no pulse, there's no blood pressure, then directly start off CPR.
Doctor, RB is Koravana, 25% dextrose. Fast, be quick.
yes, sister.
Okay.
Doctor, please.
Ooh, nice. I like how quick the sister was involved in getting into decision making. So it's always good that the sisters take care of the groundwork, making sure the patient is stable. And if at all something goes wrong, then ring up the treating doctor for help. Otherwise, all this blood sugars going up and down can be managed by the nursing staff. So she really understood that the RBS, which is the random blood sugar, was low. So she started on 25D, which is 25% of dextrose, which is again a form of sugar, glucose.
Our first bed we the patient in a log roll that spine injury rule out there. Quickly, be fast.
Sir.
ഹലോ
എടാ ഞാനാ.
ആ നീ എത്തിയോ? ജോയിൻ ചെയ്താ?
അതൊക്കെ പിന്നെ പറയാം. എടാ ഈ ലോഗ് റോൾ ചെയ്യുക എന്ന് വെച്ചാൽ എന്താ?
റോഡ് റോളറോ?
റോഡ് റോളർ അല്ലടാ കഴുതേ. ലോഗ് റോൾ. LOGROLL.
എടാ അത് നമ്മുടെ ഈ തടി ഉരുട്ടുന്നതല്ലേ?
അയ്യോ എടാ ഈ കാർ ആക്സിഡന്റ് ഒക്കെ ആയിട്ട് വരുന്ന പേഷ്യൻസ്. ഹലോ.
So what is actually a log roll? This is something which is seen mainly in ICU setup or casualty where you suspect the patient is having an injury to the spine. So because of that, what we have to do is that we have to roll the patient like a single rigid log. The only reason why we are doing this is because we have to make sure the spine is aligned in the same way, because we are already suspecting a spine injury. So we don't want to cause again a secondary spine injury. So with utmost precautions, we have to do this. So the maneuver is actually simple. So what we do is we inspect the back first, see for any injuries, bleeding, burns, etc. Then following that, we have to palpate the region and gently, with the help of your other colleagues out there, maneuver the patient, then introduce the spine board. So what do you think out there, all the actors who have done and played these doctor characters in movies, which among them did you like the most? Comment down below. And if you've come here so far, you know what to do. Leave a like and subscribe for more.
Are you ready?
Yes sir. ഇയാൾക്ക് ഇതെന്ത് പ്രശ്നമാണെന്നൊരു പിടിയും കിട്ടുന്നില്ലല്ലോ.
സിറോസിസ് ലിവർ വിത്ത് പോർട്ടൽ ഹൈപ്പർടെൻഷൻ, യൂസേജ് ഓഫ് ലിക്കർ, ഒരു ഇൻഗ്യൂനൽ ഹെർണിയുണ്ട് റൈറ്റ് സൈഡിൽ. ഹെർണിയെ പറ്റി പറഞ്ഞില്ലെങ്കിൽ തോപ്പിക്കും.
എന്ത് ഹെർണിയ?
ഇൻഗ്യൂനൽ സ്പെല്ലിംഗ് ആണോ?
വേണ്ട.
ഡയഗ്നോസിസ് കിട്ടിയോ?
യെസ് സർ.
With the help of the patient, he's got through his exam. Seems like that patient is a chronic patient who's been admitted for years together. Every yearly exam case will be same. All the consultants will know the diagnosis, his findings. Patients, I mean the students who come for examination also, they'll know what, okay, you're going to come to me asking, how are you, what happened? All stories, these patients will know what they're going to ask. And he knows what to answer them back also. So this is actually true. This has happened. I mean, to me, my colleagues, all this is something which is really true. They have incorporated in the movie scene. So it's very good. I liked it.
അയ്യോ, ഇത് തോമാച്ചൻ. ശരി, ഇപ്പൊ എന്താ പരിപാടി?
പഴയ പരിപാടി തന്നെ. ഒരു സിറ്റിങ്ങിന് 2500 രൂപയാണ് എന്റെ ഫീസ്. എനിക്കിപ്പോ ധാരാളം സ്റ്റുഡൻസ് ഉണ്ട്, ഡോക്ടർമാരെ. എത്ര പേരെയാണ് ഞാൻ ഡോക്ടർമാരാക്കിയത്. എന്തിന് സാറ് വരെ പാസ്സായില്ലേ?
It's so funny that the poor doctor has to sit over there and this patient is roasting him on his face. Like as you said, these patients who are kept as exam cases, they should have some benefits, right, for sitting as a patient for your examination. Usually the institute gives them lunch. Sometimes they give 50% reduction in their expenses or treatment or surgeries. Well, during my time for general medicine and all, we used to give some amount of money to the patient saying that thank you for coming, and if you stay for this day, we'll give you something contributed from all of us as a token of appreciation for being a patient, for sitting there whole day for us. Well, seems like nowadays it's going out of hand. People are even demanding they want this much amount, then I'll sit. Otherwise, I will not sit as your exam case. So, well, now it seems like they have very well incorporated, and yeah, it's nicely shown in the scene.
എന്താ നിന്റെ പേര്?
ശിവപ്രസാദ് രാമാനുജൻ.
Brahman.
ചിരിക്കുന്നു.
Hey, this reminds me of the scene, I mean the reaction which I did years back where Mohanlal is doing similar thing. He finds this thread, the poonulu, then he cuts it, I think. Yeah, and he's ragging them, and that full series which I've done, oh my god. Yeah, by the way, you guys also check it out. I'll link it up in the video. Do feel free to check it out. It's another set of amazing scenes and beautifully acted by Mohanlal. So many movies out there, as a real fact, they do consider talking and getting their scripts curated with real surgeons and doctors, only because to get the scenes as accurate as possible. But end of the day, they do neglect it also to obviously give the dramatic effect. So Prithviraj has acted so well and beautifully in this movie, and it shows how much it reflects the real struggles and the impact which makes in a doctor's life and how and what we go through. So here's to both the real doctors and the real doctors, and healing in their own paths. So that's all for today, my friends. I hope you guys liked today's episode of reacting to all the medical scenes acted by the one and only Prithviraj. So if you guys liked it, do comment down below. And if you guys want me to react to something else, don't forget to leave it down in the comment section down below. I will consider doing it. So as always, you guys take care, stay safe. This is Dr. Bob signing on.